Good afternoon. Good afternoon out there, and welcome to this session on a Wednesday afternoon of the PPN's week of conferences, conference week, sorry. This session is about thinking of a career, we welcome you if you're thinking of a career in the psychological professions, and it's an introduction to new roles. So very warm welcome extended to all of you, anyone thinking of a career and anyone who maybe is structuring those careers in the psychological professions. All are welcome. My name is Estelle Moore, and I am the PPN Chair for London, and I'm supported this afternoon by our Programme Manager in London, Amrit Chima, and previously to today by our experts by experience in the London region, Pod Young and Natalie Mark. So thank you to all who have been behind the scenes working on this session. So the next slide, thank you. As you know, you might be familiar with this slide by now if you've been watching all week. So our housekeeping, we would absolutely love to hear from you. And we've got some questions that we'll invite you to contribute via Slido. Come back to those shortly. If anything goes wrong for you and you experience any technical issues, you can always contact First Sight Media. The email address is there. And just to note, a reminder that the session is recorded, so if you didn't want or you preferred not for your name to appear, please do post anonymously in Slido. We always want to give as much information as possible, so we will signpost you to materials and future sessions. But otherwise, please enjoy the session. There's lots and lots of really exciting updates from people working in our new roles this afternoon. Thanks, Matt. Next slide. So just to provide some context then, change across the landscape of psychological professions is underway. And there's a number of emergent new roles established to try and deal with the shortage of psychologists and psychological professionals in the health service, and also to constructively change the way that services are offered to be psychologically informed throughout. So we need to make sure that we do evolve alongside the workforce and our communities to make sure we've got safe spaces for those who enter the psychological professions in one or even more of these new roles. So that's our context. Thank you. Next slide. How can we rise to this challenge? So the long-term plan has set out the vision and the challenge, and we've had additional impacts of late, obviously, with working through the pandemic in the NHS, the impact of that on the NHS workforce, some of the experiences of existing staff in relation to morale, well-being and burnout, and increased acuity. So people presenting to services with extra needs, perhaps because they've accumulated and built up over the period of the pandemic. So responding to all of these challenges is part of the work in terms of new roles. In addition, we've got transformation on the agenda, so there's a number of pressures for the workforce about how we manage that uncertainty and change being a good thing though, such that recruitment is on everybody's agenda in the NHS at the moment, with worries like, are we going to be able to get enough staff? So this session, thanks for the next slide, is really seeking to present some of the very best of those new roles to you. Just a reminder then, why do we do this? We really, in the psychological professions, want to be helping people with mental and physical health problems because it's a rewarding role and occupation, and we'll see some of that this afternoon. So every role in the psychological professions does involve making a contribution to someone's mental health and all-round well-being. This afternoon we'll hear that there's obviously lots of differences by setting in people, in terms of the people or the types of conditions that you may be interested in working with and the amount of training required. So we'll run through some of that. But as I said, the session aims to share the very best of the new roles. And just a signpost to tomorrow, thinking about career progression and the frameworks that ensure that career pathways are accessible to all is on the agenda with Dr. Phil Self in the afternoon tomorrow. So hopefully by the end of the week it'll feel clear. So to the next slide, thank you. the plan of this afternoon, we're going to have a reminder about the 12 psychological professions and our career map as it exists at the moment from Claire Bagley, who's done amazing work as co-chair of the PPN in the Northwest and sets that out really clearly. And then hearing about the different roles, I'll try and remember very much not to use acronyms, but psychological wellbeing practitioners we'll hear from. We had some great updates yesterday about how very much those roles are valued, and we'll hear from some psychological wellbeing practitioners talking about their work. We'll also be hearing from child wellbeing practitioners and education mental health practitioners about the difference they're making in children's services. And we're going to be hearing about the role of the clinical associate psychologist, some very enthusiastic colleagues who have been working in community teams, particularly in West London, across London. The hearing about the trainee associate psychological practitioner roles in primary care, and some advance notice of the mental health wellbeing practitioner role. So hopefully that will cover something at least of interest. You can tune in particularly to the one that's most important to you. Thank you for that slide, and we move on. What we'd love is your feedback. So there will be time. Please do share questions in the chat, but also we have some questions. Just put these into your mind at this point as you're perhaps listening, to think about what additional workforce gaps or challenges you might think we should be drawing attention to. And whether or not, as you listen, you think there may be concerns about how new roles will be embedded and supported, because we want to hear about that so we can pick those issues up. And maybe finish on a positive note, what you think from what you hear would work really well for our clients about the new roles described today. So we'll come back to those questions, so don't worry about having to remember them, just to lodge them in your minds. Okay, so moving forwards, let's hear from our very first presenter, which is Claire Bagley, who's going to tell us about the 12 psychological professions and the career map.
Hello, I'm Claire Bagley and I'm the Programme Manager for the Northwest PPN, and I'm with you for the next 10 minutes to talk to you about the range of careers that we have in the psychological professions and how you can find out more. Choosing a career in the psychological professions will open up a pathway into a career that is richly rewarding, with opportunities to work with different people across lots of different health and care settings. In this short presentation, we're going to look at the main types of psychological professions and what they do. Following this, we're going to have a look at the career map that's been developed by the psychological professions to help you understand a little bit more about the roles and how to prepare for potentially applying for training within them and a future career. To help you understand the 12 psychological professions, the Psychological Professions Network have developed this short video that we're going to watch together that outlines the main roles and what they do.
There are 12 different psychological professions. They all help with understanding the mind and making changes to improve well-being. But each one uses different kinds of approaches to help with different kinds of distress and difficulty for different people. Together, they help develop emotional well-being and provide support for the challenges we face throughout our lives. Clinical psychologists, counselling psychologists, forensic psychologists, and health psychologists all draw on psychological theory to tackle specific problems in health and social care. Using psychological science and talking therapies, they work directly with patients, families and groups, as well as with staff, teams and services. Cognitive behavioural therapists, counsellors, adult psychotherapists, child and adolescent psychotherapists, and family and systemic psychotherapists use specialist talking therapy skills usually with specific groups of people. Psychological well-being practitioners, children's well-being practitioners, and education mental health practitioners provide brief psychological interventions for specific populations. While all psychological professions have their own unique approaches, they are all part of a single family. Applying a huge wealth of psychological knowledge and research, these professions offer evidence-based, specialist care in all kinds of contexts, supporting the work done right across health and social care services. We need to expand the psychological professions, because at the moment, not everyone can access the right help when they need it. We want people who have life experience and great people skills to become psychological professionals. And there are routes in, whether or not you already have a degree or healthcare qualification. To find out more, visit the Psychological Professions Network website.
So now we know who the psychological professions are, I want to explain how you can find out more about them. So the Psychological Professions Network, alongside the video, has created a career map for the psychological professions to help people that are interested in the roles and might be interested in taking up a career in one of them to find out more. Here's the career map, and I'm just going to give you a flavour of it by us looking at it together and looking at some of the information that it provides. So first of all, the career map is divided up into 3 sections. It identifies psychological practitioners into 3 groups. We have the psychological practitioners, psychological therapists, and psychologists. Underneath these 3 headings, in the clouds below, you'll see that we have each one of the 12 roles highlighted. And when we click on them, so if we choose one of them to click on, you will enter another level of information about the role. So the first box gives you an overview of the role. And then if we click on read this article, you will see that there's much more in-depth information about the type of work that the psychological profession does, in this case a counsellor, and then below that the types of training that is required for this role, the entry requirements for training in the role, and the types of qualifications and experience that are useful to have to apply for that training, the sorts of salary expectations that you might have in that role once qualified, and future career options. And then there's further information at the bottom around registration and accreditation and professional organisations that are linked with the role. And finally, at the very bottom of the page, you'll find some useful links so that you can read more. So each one of those clouds has this same information tailored to the role included in the map. So let's just go back to the career map so we can have a look at it again, and you can see the overview. So from this map, you can see that the 12 professions have a range of opportunities for you, and you can join into the psychological professions with a number of different qualifications and experience. So hopefully what we've done through this presentation is helped you start to think about whether a career in the psychological professions might be for you. We've given you an overview of some of the roles and also given you links to the career map in order that you can find out more and start thinking about what your next steps might be to taking a career in the psychological professions. So now I'd like to thank you for spending this past 10 minutes with me. I hope that you found it interesting, and please do take a look at the career map, and the details of that will be provided on this final slide.
Thank you so much, Claire. That's fantastic. So it's a hopefully a really clear presentation of the foundation then of the 12 psychological professions. So we step forward into thinking about our first new role. And you may say new role, well, PWPs are well established, and we certainly heard yesterday about some of the fantastic evidence base and lived experience, talking about the people with lived experience talking about how much they valued this role. So psychological wellbeing practitioners are working in our adult improving access to psychological therapy services, and which has had a national rollout. There's both undergraduate and postgraduate entry routes available into this role. Salary on qualification is a band 5, and the qualification includes both graduate and postgraduate certification. And really excitingly, it's also possible to follow this route through apprenticeship. So alongside the standardised route, there's now also apprenticeship options. We'll talk a little bit more about apprenticeships a bit later this afternoon. So I'm going to hand over to 3 colleagues who are working as psychological wellbeing practitioners. Aisha, Reem and Simon are going to tell us a little bit about what they do in their day-to-day roles. Over to Aisha.
Hello, my name is Reem Alani and I'm a senior psychological wellbeing practitioner working for Ealing IAPT within the West London NHS Trust.
My name is Aisha and I'm a psychological wellbeing practitioner, so that's what my role is. You might know as a PWP for short, and I work with clients who experience low to moderate anxiety and depression. I work with adults.
My name's Simon, so I'm a senior psychological wellbeing practitioner at Back on Track IAPT service.
As a PWP, I work with members of the general public, assessing and treating them for common mental health issues like depression, anxiety, panic, and phobias. I also signpost them to services within the community that can support them.
And what I do in my job role is I do assessments. So I assess clients to, see what their main problem is, and then I offer treatment if they are suitable for the service. And we offer many different kinds of treatments, such as the main one being is guided self-help. So that's based on CBT, cognitive behavior therapy principles. We offer between 4 to 6 sessions, and they last between 30 to 35 minutes. And that's one-to-one. It's usually over the phone, but we do offer face-to-face sessions as well. And we also do some computerized CBT with the help of SilverCloud. And I offer telephone session reviews for that, or just SilverCloud reviews. And I also run groups. So one of the groups I'm currently running is called the Living Well with Stress course, and it's over Zoom at the moment, as most things are virtual. And that's 5 sessions, and they're about an hour and a half each. And that just goes through, how to manage stress well, so understanding stress and how to manage it. So we look at managing low mood, managing anxiety, managing worry, managing panic as well?
We help to assess people to make sure that we understand the difficulties that they're experiencing. And with our wealth of knowledge of the local area and the services that are around as well, what we can hopefully do is help to basically identify what is going to be the most appropriate service to support them. So sometimes that is within our own service, but it also can be elsewhere in the community as well, depending on the specific difficulty that they're suffering with. But what we hope to do is to help to identify what the difficulty is and point them in the right direction of the best support. And that's on one side of things. So we help to assess people, but what we also do is help to treat people as well. So we engage in primarily what's known as cognitive behavioural therapy, or CBT. As a psychological wellbeing practitioner, we offer what's known as guided self-help, which is quite kind of like a low intensity version of cognitive behavioural therapy. Within this, we offer up to 6 sessions of brief therapy that helps to basically helps people to understand the difficulties that they're experiencing, how to kind of, I suppose, look at that in terms of a model, and then be able to actually think about how can they move themselves out of that process, out of that vicious cycle, and be able to, I suppose, take control of their own well-being and be able to maintain that moving forward after treatment is finished.
Working as a PWP with these clients is a really rewarding role. The best part about the job is being able to support somebody who is struggling with their mental health and see them reach recovery and return to their normal selves.
I absolutely love my job role. I think it's so versatile. There's, a kind of treatment for everyone really. So I think it's great. Service users have found it really, really beneficial over the years. I've been doing this for 3 years now, and most clients do say they found it really helpful. They understand the treatment very well and they're able to implement it at home. So I think it's a really great role to do. And I love that I'm just able to, support people, help them help themselves in a way. So, help them become their own therapists. It can be stressful at times, definitely. It's, a high caseload, but low intensity work. So, you have to see a lot of clients, have to do a lot of work. So you have to be really good at managing your time. And, you need to be able to manage your own stress levels as well. But there is also case management supervision, clinical skill supervision, which are really helpful to, manage your caseload and also just develop your skills as you do the job. So there is space to, talk about, I suppose, how you're feeling and talk about your cases as well if you need any kind of support there.
So it's a really interesting role and I suppose a really interesting task to try and encapsulate all the difficulties that a person's experiencing and actually think about how can we best support this person. And that's a really kind of valuable part of this role. What we also do is engage in psychoeducational workshops. So we go out into the community and we try and engage with services in the community, not only just general places that are working in Hammersmith and Fulham, but also those kind of like more harder to reach communities as well, making sure that we're increasing access, as IAPT is known for. We're wanting to improve access and help to reach those communities that may not necessarily reach out for support when they are struggling with difficulties, particularly with mental health. So what we do is we encourage engagement from these organisations to help to kind of like tell them a little bit more about mental health, tell them a bit more about kind of how these difficulties are very common and that actually there is something that you can do about it as well. And that can really be very rewarding just to be able to, kind of feel that you're a part of the community, feel that you're actually doing something that's going to be helping for the future. Thinking about all the kind of inequalities that there are in society, it can really help to, I suppose, kind of manage that and kind of do your bit to sort of, tip the balance as such and help to increase access and create an equitable service for everyone who does live within the local area in that sense as well. In terms of thinking about how kind of what service users say about the kind of work that we do, I think sometimes it comes as a bit of a surprise. I think when we talk about short-term therapy, it's not something that's commonly known. And I think when we consider psychological therapy, sometimes it can be thought of as this kind of long-term, sitting on a leather couch and kind of like just talking through the difficulties that you're experiencing. Now that is something that can be offered, not necessarily within our service, but it can be offered elsewhere. But what we try to think about is how we can be most beneficial to a patient in a short amount of time. So being able to, help them to get back on their feet and be able to kind of take control of their own mental health. And I suppose that can be quite surprising to people when we say kind of like this will consist of 6 sessions and, it's half an hour hour over 6 weeks. So actually we're kind of spending 3 hours with that person. That can feel like a really short amount of time, but actually that can be a really sufficient amount of time to make real improvement and kind of help people to move forwards. I think sometimes when we speak to service users, they can be quite surprised about, you know, kind of like how well they've progressed in such a short period of time, and actually how effective the treatment can be. I think even in such a short space of time, as a psychological wellbeing practitioner, you can have a massive impact in terms of how a person kind of lives their life, and actually help them to really, you know, kind of crack those difficulties that they may have been suffering with for quite some time. So we do often get really good feedback. You're taught to use your own clinical judgment as part of the role. Obviously, there are policies and procedures that are in place that are there to support you, to help you feel contained in the decisions that you make. There are other kind of members of staff that you can turn to if you are confused about a case or wondering what you should do with that. But also, actually, where cases are appropriate for us to make that decision, we can do that. And I think that's really empowering to feel like, actually, I do understand this case and I can help this person to move forward, and this is the decision that we make. I think with that, it kind of really helps to kind of feel empowered and be able to kind of work on your own caseload moving forward. But also, actually, the support is always there as well. If you ever have any questions, there is always someone around. If it's your peers, if it's your supervisor, if it's your line manager, there's always someone you can talk to, just to kind of run an idea past, feel comfortable in making that decision. I suppose otherwise, in terms of the psychological wellbeing practitioner role, I think there's a lot of opportunity for diversification as well. It's not just a case of assessment and treatment. You can get involved with different champion roles. You can have special interests. You know, if you enjoy working with people who are perinatal, so they are pregnant or have given birth within the last year, you can work specifically with this client group. You can work with people with long-term physical health conditions, which is really important for the NHS and IAPT as a whole to be working with moving forwards as well. And so I think the ability to kind of diversify but also specialise can be really, really useful, and I suppose it's something that really draws people to it.
I'd just advise, if you were to, you know, think of training in this role, to have a good understanding of CBT and CBT-based support, be good at managing your time and managing a diary, be good at being able to work, you know, in a fast-paced, stressful environment. That being said, it's such a rewarding job. I absolutely love it. You know, just being able to make a difference to someone's life, and in such a small amount of time, really. You know, between 4 to 6 sessions, that's what, a month to 2 months of talking to someone for, you know, 30 to 40 minutes each time. It's not a long time, but the difference it makes is absolutely huge, and it's amazing to see that, and it just feels really great. So I would, you know, strongly encourage you to do it if you think it's something for you. I know it's not a widely known and widely spoken about job role. I wish I knew about it earlier as well. But yeah, I think it's a fantastic one to go for. Training is really good, and also there's so much room for development, career development in it.
In terms of what I would advise someone thinking about training in this role, is that it is challenging. You know, I don't think it's a surprise that IAPT is a high volume kind of working role. But I think it's very well supported. I think if you are able to be organised, you're able to manage your time effectively, then you will have no problems with that. I think the key thing is, once you kind of manage those kind of administrative ideas of things, being able to kind of make sure that you kind of do things in a timely manner, actually the role really kind of opens up in that sense. And there is always support around you. You never have to make a decision for yourself. You can always speak to a supervisor, speak to a peer, speak to a line manager about something, and actually kind of come to a confident decision around that. I think one thing that is really important about the IAPT role and kind of as a psychological wellbeing practitioner is the work that we do is evidence-based. It is something that there is a lot of research that has gone into it, and it has shown that it is effective. And often when you have that backing and when you're making those decisions or speaking to clients, actually having that confidence to know there is actually a lot of people who've gone by and who have experienced this and have actually kind of really been successful in the treatment, and actually knowing that and being able to kind of pass on that enthusiasm and that confidence to other people can be really empowering and help you to kind of make that decision in an effective way as well. So I think that's really that's a really key thing that I think people should take in mind when applying for the role or when considering this role.
If working with clients with mental health issues is something you're interested in, apply to become a PWP and work with us.
Okay, so thank you so much to Reem, Simon and Aisha there for their very upbeat and enthusiastic presentation of PWP roles. And it really does fit with the very important evidence of low intensity interventions making a huge difference that we heard about yesterday. And on a similar note, moving forwards, I just want to say a huge thank you to everybody who's posting questions in the chat. And Slido, I will be trying to pick up as many as possible. I'm going to move on, however, to thinking about the children's wellbeing practitioner role and the education and mental health practitioner role now, and hearing from two people in those roles who are working in West London, namely Rua and Ashley. Over to you guys.
Hi, my name's Rua. I'm an education mental health practitioner, or an EMHP. I work in a mental health support team, and my team lies within wider CAMHS, but I know that some other mental health support teams, or MHSTs, lie within third sector organisations or charities, but for my team I'm within CAMHS.
Hi, my name's Ashley Wilkinson. I'm a children's wellbeing practitioner in a mental health support team in Ealing. A mental health support team is a team of practitioners based up of, well, all of our practitioners are educational wellbeing practitioners and children's wellbeing practitioners like me. And we're based in schools, so although we're part of CAMHS, seen as a tier 1.5, tier 2 level, we are based in schools and we work in an early intervention service. So what that means is we work with children and young people and parents at the early signs of mental health or behavioural difficulties.
So yeah, we're very embedded with schools. I work with a lot of the school team and school staff, so teachers, designated safeguarding leads, SENCO, sometimes heads of year, and we really do our best to try and embed ourselves in the school community, so that we become that familiar face and people know us from SLT and school office staff. And just so we start to become a kind of a familiar face and somebody, within the school community.
I love this role. I've been doing it now for 3 years. In December will be 3 years. I did my training year in 2019, and then 2 years after that, I'm qualified. I really, really love this job. I think the main thing that I love about it is how closely we work with the young people and parents and families. You know, there's a lot of jobs out there that I was maybe applying to before that was a lot of admin work, but in this job we have so much face-to-face contact, clinical work, and we work with these young people and parents on a weekly basis. So there is a lot of face-to-face work, which is really, really a great part of the role. Obviously there's a lot of admin, so we do have to do a lot of that, and note taking, risk assessments, etc. But yeah, the amount of sort of face-to-face client work we get is really great.
I guess what I really love about being an EMHP is that it's a new profession, a new workforce, and it's a really different way and a new way, I guess, of supporting young people and their well-being, and parents as well. I really enjoy working with the parents. I find that really rewarding and kind of empowering, I guess. So it's nice to be able to be, that person in school who's, just about well-being. So I'm just about the children's well-being. So it's nice to be able to be that kind of professional that maybe I didn't have, or other generations haven't had in school maybe. It's really nice getting to know the young people. They're a lot of fun. They're really inspiring and amazing to work with. Young people have been through so much in their lives so far. The last couple of years has been obviously very difficult. So yeah, they really inspire me every day, and it's really amazing getting to know them. Sometimes young people, it kind of strikes me how often a young person might say that, you know, our sessions might be the first time they've really opened up or really talked about their feelings and their emotions. So even if they have, you know, supportive families and there might be systems within school, they've never had that chance to have a one-on-one conversation with a wellbeing practitioner just about their feelings and their emotions and things in their life that they find difficult. So it's nice to be able to offer that space to some young people. It's nice when you kind of get a click moment. So we might be, you know, a few sessions in, and sometimes young people might be, you know, a bit hesitant at first, and they're not sure if, you know, the CBT strategies are going to work for them. But you kind of, you know, persevere and listen to the young person, try and really hear what they're saying and understand where they're coming from. And sometimes kind of, you know, halfway in through the intervention, something just clicks and you can see their mood and start to improve. And you can see that, you know, they feel quite empowered, that they're taking steps to improve their well-being. So that's obviously like a really, nice thing to kind of witness.
Obviously, as a CWP, we do our one-to-one work and our group work, but within CAMHS, the team that we are under, there are other things that we can be a part of, other projects. So they were promoting a DAPA role within CAMHS, so that is a domestic abuse and prevention ambassador role. And this is something that I was really interested in. So I signed up for this role and got some training. So for my team now, I'm sort of seen as the point of contact for domestic abuse issues within my current team. So that's sort of an additional to alongside what I'm already doing as a CWP, but that's sort of an additional role that I volunteered myself for within the team. I think it's really important to highlight, you know, that there are other opportunities in the trust, other trainings you can be a part of if you want to. My DAPA role, I think it's really important because it promotes sort of better or good practice within the team. For example, I felt that maybe we weren't asking our young people and families enough about domestic abuse, you know, in our assessment or our risk assessment that we were doing when we first meet them. So I kind of took this role as well as some other fantastic practitioners within my team, and we updated our risk assessments so that we made it more clear about domestic abuse and asking more clear questions so that we could then support our families better. So yeah, there are other opportunities for extra training within CAMHS.
If I was going to give any advice to anyone thinking about training as an EMHP, or maybe you're kind of already in your training year, in your training, just enjoy and embrace like the learning process. You get to work with some amazing tutors, some really great unis. It's just a brilliant opportunity to be able to learn and study, but while being in a paid role and progressing in your career in that way. So just, embrace it, enjoy it, and just be proud, that you're part of this kind of new workforce, which is really, really exciting. I'd say a few people on my cohort were a little bit nervous about working with parents, so they felt quite confident about working with young people and children, but they felt a bit nervous about working with parents. But I would just say the training will prepare you, and you'll learn so much. And parents are such a joy to work with, because often it's really nice to be able to offer them that hour a week where it's just, about them and their family. You can talk things through to them and offer them some really, like practical tips and strategies that they really appreciate. So, just enjoy it. Enjoy all the learning experiences. And it's an amazing role to be in. You'll definitely have a lot of fun, and stay connected with your team. So often we're going out into different schools, so we can be in different places every day, but it's really important to stay connected to your team and just create opportunities to learn off each other, stay connected, ask each other, how's it going in your school, how's this going, how's that going. Stay connected with your team.
One thing we try really hard to do in our team is to gain feedback from our young people and parents. I think that's really, really important, because then it helps what we might do in the next session or in the next intervention with another family, for example. In the summer holidays just gone, we did a online parenting group to support parents in improving their child's behaviour. We wanted to gain as much feedback as we could for this one, because it was part of a new thing we were trying out online groups, seeing how that would work, and especially seeing how it would work in the summer. So yeah, our families, we got some really good feedback from our parents in that group. They really liked the elements that we had introduced. You know, it was things like praise and rewards and spending time with your child, how to talk about feelings. You know, we introduced things like watching Inside Out with them and having a little chat and think about what they learned from that movie and what they liked about it. So yeah, it's obviously a little bit easier to receive feedback from parents than young people. Obviously, it might be a bit difficult for a young person to talk to us about how we work or how they think we worked and what went well, what didn't go so well. But yeah, I think it's important to get feedback from those parents, and then we always try to do a 6-week follow-up if we can with the family. And, you know, at that point we gain feedback about how they found the intervention worked, what went well, what didn't go so well. And, you know, there are times when it may not have worked as well, but then they can give us sort of tips and pointers on sort of where to go next time.
Yeah, another thing that I really enjoy is being part of the CAMS community. So we work in our schools, but we're also part of CAMS, which means there's some really great training opportunities. There's often webinars and workshops that are open to the whole of CAMS, so you get to go and be part of that, which is great for your professional development. But it also means you can connect with other professionals within your trust, which is, yeah, really a nice feeling.
Fantastic. Thank you so much to Rua and colleagues and Ashley there for their summary of the work that they're doing, which is so exciting when you hear about it in that way. Just also mindful that there's a number of questions. Really great to hear from you with questions in the chat about the career framework and its development. So just a quick comment on that. We will be including the new roles for sure, and they are developed as part of a national rollout, particularly we'll hear in a minute about from Alison Brabham on the mental health wellbeing practitioner role. If you were looking for an advert for a new role, try NHS jobs. So that's hopefully that's answered at least one of your questions. And also for those who have less of an academic background, there are some assistant practitioner roles that are being developed in the Northwest and the Southwest. So thank you for those questions. We are moving forward with the next section, which is around the clinical associates in psychology. And thank you to those who've asked about the career development in this area. First of all, let's hear about what a clinical associate in psychology does. So it does depend a bit on the population or speciality area. So there are CAPs working in adult and community services, and increasingly I think there's new CAPs roles in children's services, children and adolescent services. So this is an apprenticeship role. So an apprenticeship is essentially a job that's with training, and this is very exciting because this engages both employers, with other organisations, universities in rolling out the master's degree qualification, and really trying to make sure that we map onto what our local communities need. And I think some of the description of this work is really well explained in the following film. Salary on qualification for the CAP is a band 6, and it's a master's degree. Sorry, perhaps I already said that. So we're going to I think on the next slide, there's a very exciting poster about what the clinical associate psychologists in London feel is really good about being a CAP. Words like innovation and improving access and all sorts of exciting things. We're going to hear from a number of them. So again, sorry, there's so much to fit in that we wanted to hear from as many as possible. We're going to hear in a moment, I think if we just put the next slide up, from Samir and Amy, from Sabrina and Mark, Nadia and Leah, Marie, and also supervisor Angela Husband. So we've had in a kind of blended conversation about the role of clinical associate psychologists. So I will hand over to Samir.
Hi, my name is Samia. I am an apprentice clinical associate in psychology, currently undertaking the course at UCL, and I work under CNWL Trust in a community mental health team.
And hi, I'm Angela Husband. I'm a clinical psychologist and I work for East London Foundation Trust, and I work with CAPs in my daily role. So I'm going to ask Samia some questions about her role as a CAP. So Samia, what's it like to be a CAP in the setting you're working in?
It's good, I would say. So as I said, I work in an adult community mental health team and also supporting the memory service as well, where I am at the moment. And it's really good because I feel very integrated within the team. I feel like now, as opposed to maybe earlier on in when I started, that I feel I know what a CAP does now, because I think with the first cohorts, it's kind of difficult to kind of get that understanding. It's really nice just having good support as well from supervision and other colleagues, and always knowing that, we've got reflective group practice at work and with the course as well. So it's always knowing that you can always have some outlet or some further understanding into anything that I may find challenging.
Sounds great. And what activities do you undertake as a CAP?
So I basically do one-to-one interventions and assessments for the psychology team. I also do triage assessments for the whole team. So I work across 3 community mental health hubs. And that obviously means that I would go feed it back to the team and to my supervisor just to get further understanding of what the next steps are. I also co-facilitate groups, do a bit of auditing just to see how we can do further improvements within the service. And for the memory service, I do MCI reviews. So they're the mild cognitive impairment reviews for clients that attend the service. So quite a lot of things, quite a lot of activities.
Sounds busy.
Yeah.
Yeah, great. I mean, it's great to hear. Can you give us an example of some service user feedback on your role?
Yeah, so this is a good one. So what I recently did actually with a client was structured clinical management, so SCM, and we were going through the module of problem solving. So we already went through identifying a specific problem, and then trying to generate solutions for it. So for that session, we went and used the room with a whiteboard and a pen, and it was very interactive, very collaborative as well. So I remember once that session ended, the client telling me that she really enjoyed the session, and because it was actually quite collaborative and it didn't feel due to her previous experiences where she felt like she was being blamed for something and she's unable to solve a situation. So it was good feedback, I would say.
Hi there, my name is Amy and I'm a trainee clinical associate psychologist, and I'm based in a community mental health service and also studying at UCL. So in terms of usual working day, it usually starts with emails and then moves to a daily planning meeting with the MDT to discuss client support for the day and also prioritise based on need.
I start my day by going to the daily planning and zoning meeting within my team, which is an MDT space where people can bring the clients that they're working with, if they're stuck with kind of where to go next, or want more input, or thinking about kind of risk or next steps, just a space to think more broadly about the client. We can kind of signpost them to third sector organisations that we might be aware of, and it's just a really nice collaborative space to kind of think more broadly about clients and their care. Generally then throughout the day I might have a group intervention that I'm running, I might have individual clients that I see, and also involvement in assessments. So there's either brief assessments into the team, kind of collecting more information to think about where else they might, how the service might be able to support them, or it might be more psychologically focused, so someone who's on our psychology waiting list, and that's kind of developing a bit more of a formulation, so all kinds of assessments I might be involved with. And then generally towards the end of the day, that is when I kind of carve out time for admin. So that might be kind of sending emails, checking in on clients, writing up notes from any interventions or assessments that I might have done. And it's also a time to kind of debrief with the rest of the team as well. So yeah, all in all, that's a general day in the life of a CAP.
A piece of work that I'm proud of as a CAP is recently completing individual sessions with a client to help kind of provide skills and techniques to manage anxiety. We were able to kind of work through collaboratively meeting the goals of the client and the needs, and also being able to provide that extra support afterwards to have something to fall back on by creating the end of therapy blueprint and providing a list of resources and groups for future reference.
Some of the work that I'm proud of as being a CAP is the ability to kind of be able to bring in some psychological thinking to team meetings, and kind of learning sometimes when is the right time to kind of signpost someone for an intervention, or if a client's not there yet, just being able to kind of talk to the other colleagues and disciplines and think and try to get them to think a bit more kind of psychologically and kind of develop formulations that might help other people to kind of deliver nursing interventions or OT interventions, link workers, peer support workers. So that's the kind of part that I'm most proud of, is being able to work with my team members and support clients not so directly, in an indirect way.
Hi, I'm Leah Marie. I am one of the clinical associates in psychology in training.
Hi, my name is Nadia. I'm one of the clinical associates in psychology. We also have group development meetings that include people participation leads and also experts by experience to help really shape and change the transformation into something that the patients and the service users kind of want, and the community wants, rather than being professional led. Anything else?
Yeah, I suppose as well as clinical psychological groups, we also have community engagement groups as well, which you've mentioned previously. So in those areas, again, we're looking to help improve population and overall community health as well. So we'll be asking residents as well as service users and leads from the community, voluntary and faith sectors to help us integrate ways in which we can improve our ways of working to help just do that, both within our services as well as within the communities that we serve.
The first question is, what is it like to be a supervisor of a CAP in the setting that you are working in?
Well, I work in a community team, a primary care networks. We've been developing a service there as part of the community mental health transformation, and it's been really fabulous to work alongside CAPs and doing that as new roles in the process. And I guess, you know, we're really passionate about offering a service to people who often traditionally sort of fall between the gaps of services. So they don't often sort of fit neatly within our psychotherapy structures, and I guess the CAPs have really come with an enthusiasm about working with groups that do struggle to traditionally access our services, and their value space has been really great for the work, and it's been really wonderful to just see their skills and competencies grow over the time we've worked with them, and really sort of grow with the service provision that we're providing, and form great relationships with our teams and stakeholders more generally. They really are very patient-centered in their approach, and really understand, I suppose, a lot of the challenges. I think we've got people who have great links to local areas. They've got understanding of some of the barriers to accessing services, and it's been great to see their enthusiasm and willingness to approach the role and work alongside us in developing something that's quite new and unique.
And last one, what would you advise someone thinking of applying for a CAP role?
I guess, I guess that they are bringing something quite unique, and I think it's really good that we, from the recruitment that we've done, it's been a very values-based recruitment, and we've really encouraged people to think about their own personal motivations for taking up this work. And I think that's what's been great, for people who really want to work as part of a team, and also they really want to have, patients and the clients they work with at the heart of what they do. It's a fabulous opportunity. I guess, lots of training routes into psychology and psychotherapy are quite lengthy, and I guess, by enabling people who've got a lot of experience in other areas alongside their clinical, their psychology degree, to access, a route into a career route, I think it's been really, really fantastic. And I guess, being able to sort of connect with your own life experience, your motivations for applying for the role, I think it's been really great to see that. And I think they've opened my eyes particularly to different ways of working. So I think it's really great. A great opportunity, and look forward to seeing how the CAP role grows in different areas as well.
Thank you, Angela.
Excellent. So thank you so much to that team of CAPs telling us about how their role is being embedded. And I'm just really mindful of some of the questions that people are asking. It's wonderful to see so many questions. I'm not sure we're going to be able to answer all of them, but yes, with the particularly with the CAPs role, it is somebody's asked, if you're a non-psychology graduate, can you apply? And the answer to that is not at the moment. The focus for the apprenticeship clinical associate psychology is for psychology graduates, and it is the case that is an employer-led development. So it's up to local NHS trusts both to decide to host CAPs and also to fund them. So that is the case for those particular roles. Just think if I've captured everything, probably not, but I can come back to that. So if you've got the energy, hopefully we can move on to thinking about our fourth new role, which is the trainee associate psychological practitioner role. Sometimes called an AP, an associate psychological practitioner, or with trainee in front of it, namely a TAP. And this is a fantastic development, thinking back to where we started, which is the need to support a burgeoning NHS with a high rates of referrals, a development pilot project in the Northwest, supporting with a graduate entry. Sorry, I don't know if there's a slide for just to cover this, if we go back one slide, perhaps, Matt. Thank you. Yes, sorry. Yes, this project being based on the Northwest Coast, is a postgraduate diploma, not an apprenticeship, and the salary on qualification being a band 5. This particularly going to hear this afternoon from two colleagues, Charlotte and Addy, who have been working in primary care, making a huge difference to supporting people in the Northwest area. So let's hear from Charlotte and Addy, and then we'll come back to some of the questions that you're asking. So Charlotte and Addy.
Hello, I'm Addy, and I'm a trainee associate psychological practitioner. That's a new role in the NHS, and the way that I explain it to the people that I work with is that it means I use psychologically informed approaches to help somebody start something, stop something, change something. That's usually why they come and see me. The people that I work with range from 13 to 89, so a really broad spectrum of people, and they're coming to see me in the GP practice. They want to make positive changes to their mood, their well-being, their sleep, their physical health, adjusting to COVID. I've seen such a wide range of reasons for referral, including some quite unusual cases, so skin picking and hoarding, and I've used my supervision for support. Working in a GP practice is completely unlike anything I've done before. I've only ever worked in secondary services or specialist services, and I really don't think that I would be able to have this clinical experience anywhere else. I work one-to-one with people, so 3 days a week is one-to-one appointments, using assessment, formulation, a range of psychologically informed approaches, so solution focus, mindfulness, 5 ways to well-being, compassion, CBT, lots of different approaches that I'm informed by. Also, 1 day a week I do community work, so this is going out to third sector and charities, helping them with wellbeing workshops, even going and standing in the town square and encouraging people to get health checks and to talk about what they do for their wellbeing. And later on this month, hopefully with the social prescribers in my GP surgery, I'm going to be doing some group workshops for 8 to 10 people based around the 5 ways to wellbeing. The feedback that I've got has been really positive. One person I worked with said it was like having a pit crew, that they could access the GP, the practice nurse, the physiotherapist and myself, get lots of support around the fact that they've had a long-term life-changing illness and disability, and help them to feel like themselves again. I've had hugs, I've had really positive feedback. We always try and get feedback from people, and so far that has been really positive. I love working in this role. The range of people that I get to work with has just been fantastic. I can work holistically. I pick and choose the most appropriate therapeutic approach for that person, which is fantastic. So my advice to somebody coming into this role, thinking about becoming a trainee associate psychological practitioner, you really need to be organised, motivated and enthusiastic. You're going into a service where traditionally there hasn't been psychology before, so you are forging ahead, making that pathway, setting out how it's going to work. You need to be really flexible and open, but this job will be what you make of it.
Hello, my name is Charlotte and I'm a trainee associate psychological practitioner. So I work within mental health prevention and promotion. So that's with people with mild to moderate difficulties with mental health. So within my role, I currently work in Barrow, so I work across 10 GP practices because that's the size of my primary care network. And I work within the practices offering one-to-one interventions to all the patients within the practice who are referred to me. So they could be referred to me by the GPs or by the nurse. They can also self-refer if they're aware of the role. And yeah, any other professionals within the PCN that want to refer to me, that can be done as well. So I work with all ages, so 0 to 100, I suppose. So it's a really varied role. And the brief interventions kind of comprise of CBT-informed techniques, mindfulness-based techniques of compassion focus therapy. I've done sessions on sleep hygiene, just anything general well-being. Yeah, is essentially my role. So I offer the assessments in the GP setting. So when someone's referred to me, I'll see them face to face in their doctor's practice, and it's been really well liked within the people that have used it, because there's no stigma attached to them coming to see me in their own GP practice. I guess no one knows why they're at the doctor's if they're ever seen going there, so they don't know that it's about mental health. And so I can offer up to 45 minutes for that kind of initial assessment time. So it's a really nice length of time to be able to hear someone's story, a lot more time than I suppose the GPs have with them, which is generally about 10 minutes. So even if maybe my service isn't suitable for them, I can then refer them on to someone who might be more suitable. And also I can see people who are on a long waiting list somewhere else. So, for example, in Barrow, there's First Steps, which is the IAPT. So if perhaps they're on a waiting list somewhere else, be it for CAMHS or something like an IAPT service, I could maybe see someone for the brief intervention, which is up to 5 sessions. And with people maybe in that aspect, I'd maybe do work around setting goals and preparing them for the therapy that they might be waiting for. So within my role, as well as doing the one-to-one interventions, I also do community work. And one thing I really like about this role is that you can kind of play it to your own strengths. So my background is working with children and young people. So I focus a lot of my community work around working with young people, which was actually as well a real catchment group within Barrow. So I made links with local schools and I delivered wellbeing workshops. And they were really successful. I focused them around the 5 ways to wellbeing, and they were kind of within the summer school programme that are offered to children and young people who receive free school meals. I've also done training for mental health practitioners and staff working with young people on autism, which again is a strength and a passion of mine. And I feel like these kind of community work days have been really beneficial to reach people from a wider group rather than just kind of the one-to-one. Feedback from people that I've seen has been really positive. So as I said at the start, there's no stigma coming to see me at the GP practice. So for example, I was seeing a gentleman and his phone rang and he just said to them, oh, I'm just at the doctor's. So it's really private, really kind of accessible. There's no kind of stigma as well. So some of the feedback that I've received as well from the patient experience questionnaire that I give out at the end, it was kind of quotes like, it's made me feel like I'm back to my old self again. Thank you for guiding me back to my old self. And there's been a lot of feedback about the fact that it's so low level, so they haven't had to kind of get worse and haven't kind of had to deteriorate in order to be seen, which has been really, really great for people. So what I love about the role is, so first of all, the autonomy. So, as I said, I'm able to focus on my community days with young people. I'm able to kind of structure my day as I feel is most suitable. So if people maybe need to see me later, I can structure my day so that I'm at the GP practice slightly later, so people can come see me after work, vice versa for the mornings as well. And as well, what I really like is because I work across so many different GP practices, I have met so many members of staff. I think I'm going to probably be at about 7 Christmas parties this year because of all the different groups I work within. So yeah, that's one thing I really love about it as well. So if I was to give advice to someone training this role, I suppose I would say that you need to be really organised and you need to be really, really proactive. Because it is a new role, you have to make sure that you are putting yourself out there, willing to make meetings and contact with people within the area. I had so many Teams and Zoom meetings with people throughout the community when I first started to kind of get to know what there was in Barrow and where I could fit my role in. As well, I guess within the training, when you start in the role, I'd say make sure that you use the time that you have in between any sessions, or maybe if you've got a bit of time on a community day, to read around all the different interventions that you're using. Because I guess the more that you have in the toolkit, in like your personal toolkit, the more useful your interventions will be for the people that you're seeing. I know I've got a wealth of resources now that I use all the time, and that's only been through me kind of collating them through like clinical supervision and clinical skills, as well as the course. So that's really important. And lastly, I'd say if you were starting in this role, make really good connections with all the staff you're going to work with, because that's been the most invaluable thing for me. Working alongside doctors and nurses, receptionists, people within the community, it's been really, really important that they know me as a person. They get to know me, they get to know what I can do, what I can't do, and I guess that's only been possible because I've put the time and effort in to kind of get to know them and set up the meetings and that kind of thing. So make really good connections. And yeah, that's the role in a nutshell, I suppose. It's been really, really rewarding doing this role. It's been a challenge, but it's been a really good challenge, and I really enjoy working as a TAP.
Brilliant. Thank you so much to Charlotte and Addy for explaining the value of their role with such enthusiasm. I'm just wondering, before we move to our fifth new role, just to pick up see if I can pick up some of the questions that you've shared, which are fantastic. To have that level of engagement is brilliant. Thank you. One of them was around what's the difference between what a psychological practitioner is and what a psychological therapist is. So coming back a little bit to the beginning of the foundations, I guess what some of the differences relate to training qualifications and the nature of the intervention that the individual offers. So psychological therapists tending to work with more high intensity case material or referrals, whereas psychological practitioners, not always, but tending to work with the slightly less complex case material. Practitioner psychologists will have a doctoral level training in the background. So I don't know if that helps, but I just try to, there's a lot of words like psychological and practitioner that I'm repeating here, so I'm hoping I'm trying to bring some clarity to that. In addition, there was a question around, let me just check, sorry, just reading. When we take in cohorts, when we're advertising for children wellbeing practitioners and psychological wellbeing practitioners, it's more than once a year in some areas. So let me just check on the, yes, so courses usually starting in September, October, with additional intakes in February or March in some years. Probably the best place to refer to you for that information would be the BCP accredited courses list to find out when training providers are seeking entrance. And so I think what we ought to be doing is pledging that on the PPN England website that we provide as much information about the new roles as we possibly can. So the new roles, another question was around whether the new roles will be recognised by the BPS, the British Psychological Society, and the HCPC, the Health and Care Professions Council. So just to let you know that PWPs are now being registered under the BABCP, the British Association of Behavioural and Cognitive Psychotherapies, and on the BPS register. And this will provide a model for other new roles. So we're working as hard as we can to set all that in motion across those roles. So that's a couple of the most popular questions, just to respond to that, to those. So if I could move on to the next slide, if possible. Thank you, Matt. So the fifth new role that we'll be talking about this afternoon and hearing from the people behind the scenes in terms of setting this up shortly around is the mental health and wellbeing practitioner role. Just move all my questions off to the side right here in a minute. So we're going to hear about the need for support in adult community mental health settings. So we've heard about primary care, we've heard about children and wellbeing services. This is in terms of moving more into secondary care. That there is a national rollout planned, that there will be, thinking about the previous question, both a postgraduate entry route and an undergraduate entry route for this scheme, and that the salary on qualification would be a band 5. Once qualified, people would have a graduate and postgraduate certificate. It is currently not an apprenticeship route, so it's a national rollout with funding. So I'm going to really pleased to invite Geeta Bhutani, who's the PPN Northwest co-chair and the an England co-chair, PPN England co-chair, who's talking with Alison Brabham, who is the clinical advisor to the NHS England and Improvement Adult Mental Health Programme. So we will hear from them about the setting up of this role.
Welcome everyone. We're here to talk about a new role this afternoon, and I'm Geeta Bhutani. I'm the co-chair of PPN England and also the co-chair in the North West.
Thanks, Geeta. Good afternoon. I'm Alison Brabham. I'm National Clinical Advisor to the Adult Mental Health Programme at NHS England and Improvement. And the reason I'm here today is because I've had a lot to do with the development of the mental health wellbeing practitioner role.
Thank you, Alison. So can you tell us a bit more about the role?
Okay, well, it is a wellbeing practitioner role, as I said. The title is Mental Health Wellbeing Practitioner, but it's a parallel role to a few of the other wellbeing practitioner roles that already exist. So we already have psychological wellbeing practitioner roles. We have children and young people's wellbeing practitioner roles. This mental health wellbeing practitioner role is different in that it's focused specifically on people with severe mental health problems or complex needs. I suppose in terms of what it's doing, there are two kind of key elements to the role. One is a case management element to the role, and the second part is about delivering well-being focused psychological well-being interventions that are kind of developed from best practice and best evidence at this moment in time. So by that, I'm thinking about things such as behavioural activation, helping people get a better night's sleep, recognizing your emotions and managing emotions, managing medication. We're thinking about a discrete list of kind of interventions that we know will really benefit the kind of population that the mental health wellbeing practitioners will be working with. So two kind of main prongs.
Thanks. So they'll be working in teams with other colleagues. What difference do you see them making to the work of those teams?
Okay. Well, I think first and foremost, I think when we've listened to what's happening in teams at present time, we're so aware of the pressures that teams are under. So during COVID, there has been a huge increase in referrals and the acuity of presentations has gone up as well. And we're just hearing that teams are on their knees. So I think that one of the kind of big kind of ambitions is to ensure that by having more staff in teams, and we know that recruitment is also a big problem. So this hopefully will give us a new workforce who we can recruit into teams and to improve the kind of capacity of teams. The other kind of element I've got to say, and it's part of my national role, is to think about how can we improve access to psychological therapies for people with severe mental health problems. And one of the biggest stumbling blocks in terms of getting people to train and to actually deliver psychological therapies is to do with competing demands. People just don't have the time to go off and do the training, or if they do get time to go off on training, they often come back into the team and there are just so many demands that they don't have that protected time to actually deliver the therapy. Now, the mental health wellbeing practitioner isn't going to be delivering therapy. That is not part of the role. However, we hope that by putting extra capacity into the team, it will allow more kind of qualified staff or more experienced staff to actually find the time to go off and do the training. And if they have done the training, then to come back and to have time within teams to actually deliver psychological therapies. So we want these mental health wellbeing practitioners to give staff the time to actually deliver and train as psychological therapists. So it's about expanding the capacity of teams, hopefully allowing us a new workforce in terms of recruitment, and thirdly, as I say, giving teams enough time to deliver meaningful evidence-based interventions as well.
Thanks, that's really exciting, and we do know that service users want access to more psychological therapies, and it sounds like this is a real way forward to making a difference to the people whom we offer services to. So, to cut to the chase, how do you become one?
Okay, Well, first of all, this is a university-based training. So anyone who can work at degree level, at what we class as an academic level 6, which is a degree certificate level, anyone who can work at that level can apply. And it is, or the other level is that this training is also going to be at level 7, which is a postgraduate certificate. So if you can work at degree level or you have a degree, and it can be any degree, it doesn't have to be a psychology degree, you can apply to do this training. You will be getting 45 days, of training altogether. So 30 of those will be university based and 15 days will be kind of directed learning whilst you're working in the clinical setting. So 45 days, plus obviously supervision is going to be essential to this as well. So you will be employed as a Band 4 worker whilst you're doing the training, and then post-qualification you'll be working as a Band 5. And I suppose one of the things that we're really keen to do is, as I say, we know that recruitment is a real problem. And I think that this role really does offer an opportunity as well to kind of think about a new workforce in mental health, to really try and attract people from the local community to kind of apply and work in mental health. And I suppose one of the ambitions is to really try and recruit people who represent the local demographic, so that we're kind of getting a much kind of broader range of people working in mental health. And as I say, one that does actually reflect the local community.
It's really exciting. So when is all this going to start?
Well, Health Education England, who have been doing the commissioning of the training, they hope to kind of get everything finalised, and an announcement will either be coming out very soon or it might have already come out by the time of the conference. And the idea is that trusts and HEIs will work together to recruit these mental health wellbeing practitioners into the training posts. That should be happening hopefully around Christmas time, with the idea that the mental health wellbeing practitioner training will start in March of next year, so 2022. We hope that there will be about 280 places for the first cohort in terms of training, and we hope that that will then expand to about 560, so doubling. If we can get the money, we hope that we can double those number of places across the next kind of, well, the academic year starting in, as I say, April 20, well, it's the financial year starting in April 2022. So we hope that there's a demand. We're hearing from services that people are really keen to employ mental health wellbeing practitioners. So we think that the issue is going to be actually capacity to actually provide mental health wellbeing practitioners, rather than a kind of an issue to do with demand or a lack of demand. I think services are really keen to get these new workers into post.
Thank you. And thanks for explaining that all to us today. It's going to be such an exciting opportunity. Thanks again.
Thanks, Geeta. Thanks for giving me an opportunity to talk about the new role.
Brilliant. Thank you so much, Geeta and Ali there. So hopefully Ali did answer, slightly answer a question around the commissioning of the new roles. Obviously, it depends on the role, but that question about who's funding all this. So some of the training, as we heard, is commissioned by Health Education England, and others by employers who use the apprenticeship levy, which supports training on the job or in job training. That such roles themselves are funded by employers as part of the expansion of mental health services, which is driven by the NHS long-term plan. And just a note, just thinking, we mentioned that NHS Jobs is advertising, does a lot of advertising is done through NHS Jobs, but also to remind people, you could check more widely, because some employers are non-NHS, so those are advertising posts in the local authority or third sector. So just want to say an enormous thank you, because to all of those people who've presented so enthusiastically about their roles, but also the people behind the scenes. So there's those people that have been involved in developing the new roles, colleagues like Ravi Rana in London, who's involved in the Trailblazers role for CAPS, and Kieran O'Driscoll, Ali Tomlins, who worked very hard on the UCL course to support us with the hearing more about clinical associates in psychology, the Trailblazer project, the pilot project in the Northwest, led by Miranda Budd and Mark Joy, the work of Elizabeth Gray in the Sussex Partnership with PWPs, and the list is long, but I just wanted to just make sure that we do acknowledge that a lot of hard work behind the scenes. So at the beginning, before we heard from others, we were just invited you to give us a little bit of an idea of what you were thinking about these things, and clearly there's lots and lots of questions that we will endeavour to come back to and make sure we do share information via the PPN England via our website. I think that is going to be a really important development. But can I just turn to Slido to see what's been happening as well with your thoughts about these questions. So I wonder if you could load up what's happened there under what people think about other workforce gaps that we might need to draw attention to. Right. Okay. Thank you very much, Matt, for showing us that. So we've got asking about gaps so important. Let me just see if I can. I can't quite see the whole screen, but I can see that we've got some thoughts from people around some of the discrepancies, geographical discrepancies. So what's available to people, what's available in terms of professionally by area. We've got some thoughts around coaching and whether the psychology of coaching might be included, and a huge gap in terms of trauma. Now that's definitely a really important area to be considering. I guess that's I suppose perhaps hidden in some of these presentations, but we will certainly be that's certainly a focus of attention for other work within the PPN and across the psychological professions. Is this still gaps and challenges? Right. Oh, it's just got a little bit bigger. Sorry. Just having a look here. Yes, thinking about reaching out and making sure we have the right access for people where English is not their first language. And certainly we're hearing, I think there's presentations tomorrow around making sure we've got access as accessible as possible. That's, I suppose I guess it's being added to. So thank you very much for helping us to focus on some of those challenges. My apologies if I can't quite read all of them. Yes, autism has come up there as yes. What about people with neurodiverse issues and their access to care? Right. Okay. Can we bring up the second slide? Thank you very much for highlighting those gaps. We will come back to them. Are there any worries, we asked, are there any worries that you'd like to share about how all of this will embed in the system? Because that's certainly a worry that I know that the Trust consider in terms of the expansion agenda and make sure we both deliver services and recruit for the future. So yes. The feeling of being spread very thin, something that's addressed here. Some people saying they haven't got worries, which is great. I assume that's what no means there. Something around retention. Are there too many different new roles? Yeah, I get you, whoever's commented there. I think when things feel unfamiliar, it is difficult to get your head around them. But I think as we begin to see, hopefully, how they can fit together, then hopefully we can see how there is space for all, and the contribution that people are making hopefully some of that came through today. I'm just looking at very importantly, the whole business of career development and progression is absolutely key. And so I'm not saying we've got all the answers yet, but certainly we've got tomorrow afternoon session to pick that up, because we're very clear that with new roles, we need proper career framework and embedding and standards and governance. So all of those things will be working with the wider system, of course. So the very last question, just mindful of the time and the end of the afternoon, is what do you think will work? So thank you so much for helping us here with what that might look like, how many ease of accessibility. So increasing access is clearly something of a winner here, and making sure we have clarity of roles and clear development plans. So that's really, really helpful. Thank you so much for engaging so brilliantly all afternoon with this, for listening to all our colleagues who've presented so clearly. If it's okay, Matt, I'd like to just go to the last slide, given it's nearly three in the afternoon and people will be doing moving forward with other things. What have we learned this afternoon? Well, I don't know. This is just some reflections. I think we've learned that improving access to psychological interventions is a key deliverable within the long-term plan, and that we have to do something about it. We have to make sure that given the pandemic, given the increasing demand, given all the innovations that face us, digital, technological, and the importance of looking after our workforce in the balance, is that that we have a plan that the new roles will bring really helpful benefits to clients. We've been reminded with the really helpful feedback and questions about the need to move away from short-term roles, role pathway and short-term pathway fixes, to having a sustainable workforce supply, including recognised graduate entry points and an integrated career pathway. And on that note, at 3 p.m, I just want to move to the very last slides and say a huge thank you to everybody who's been involved this afternoon with the new role session. Please let us know, you've really engaged well, so much, thank you. Please let us know what you thought. There's 3 evaluation questions in the window. Please do that before you submit your feedback, so that you get your certificate for attendance this afternoon. A huge thank you to everybody, and we look forward to addressing your questions going forwards.